Thank you, Simon. This is really cool. I wish I could have definitely been there, but it's great to be here, and I wish I could see everybody. But actually, you know what we'll do is as I get through this, we'll open this up for some question and answers. That way, if anybody wants to actually go through anything or has any comments, please just let me know. Okay. All right. So can you guys see my screen? Okay, Simon.
Yes, fine.
Okay, perfect. So what I'm going to do is I'm going to talk a little bit about obviously the brain, and I'm going to go through some stuff on cellular health, because if we look at chronic disease right now and what's going on with chronic disease, we have a situation where the individual cell, the components within the cell, are really ceasing to function as well as they should. So tissue loses resilience. When tissue loses resilience, organ systems start to fail faster and we age quicker. So one of the things that lasers do and especially when you combine it with other lifestyle interventions, some nutrition and things like that, is it really increases the resilience, the ability of the tissue, any tissue that you're really looking at.
Oh, he's frozen. Must be.
Can you guys hear me?
Yep, we've got you back now. I don't know whether that was an intermittent Wi-Fi signal, but yeah, you're back now.
Okay, yeah, so anyway, what I was just saying is, if we can just increase cellular health, then all tissues can maintain viability. That's why it's, whatever kind of practitioner you are right now, or what you do in your day-to-day practice, the reason why lasers are so good is their versatility. They can be used on so many different parts of the body, the brain being a big one. Now, the reason why I talk about the brain so much is because the brain has something to do with everything. Your brain controls your guts. And then in return, your guts actually control your brain. Your brain controls your thyroid. Your brain controls your sex hormones to a certain extent. Your brain controls your ability to detox. Your brain even controls your immune system. And when all of those are regulated by a healthy brain, they in turn go back up and have an influence on the brain. Just one other example. So again, if your brain is controlling your gut and that is not working well, and now your gut becomes a little bit leaky, you don't break down foods very good, you start to get inflammation within the gut, it gets into the system, it goes back up and it messes up your blood-brain barrier, and it causes your brain to become distorted in regards to its overall function. So it's really kind of interesting. We've got about 150 of these loops mapped out and how they all interact with each other. The great thing is the laser can be programmed and utilized with the different wavelengths and so forth to make a change in all of those things. There's not a single drug or a single nutrient that can do that. That's why the laser is so good, because they can really kind of get in there and help all this stuff. So anyway, this is me. If you guys, Simon, I'll give you the whole presentation when we're done. I won't get through all of it because it's a far presentation, but I have one section up front for you to take a look at here.
No
okay,
problem.
So take a look at this here real quick. Let's look at what we're dealing with here. So the brain, it's 3 pounds. All right, it generates enough to power actually a light bulb. 86 billion neurons, 10,000 connections, 100 trillion synapses. That's more, stars than we have in the Milky Way. Look, it's really interesting. Just during this presentation, this talk, over the next hour and a half, 2 hours, you will generate 2 pounds of ATP within your mitochondria just from brain activity. That's how much you have to have good mitochondrial health, and that is how much energy your brain uses. So this is a tremendously, it's an organ that will never be duplicated, replicated. Nothing will ever be like it. The brain is the most amazing thing. And when we're looking at how do we stay healthy here, we have to have, and I just kind of laid out some things that I think are really important. We have to have good mitochondrial and cellular health here, okay? And I think can you guys see the marking I'm doing on the screen here?
Yeah.
I think you can. Okay, good. And then we have to have good immune regulation, because if you're inflamed, the mitochondria is going to shut down. And if you're chronically inflamed, you're going to get disease. And by the way, we do know that laser has an effect on the immune system, and laser has a huge impact on mitochondria. So there we go. There's 2 big things that laser does. Now, your gut has to be healthy, because if it's not, 60 to 80% of your immune system lives in the gut. We know that laser has a big effect on your microbiome. and the lining of your gut health, and also the ability of this gut right here to have good peristalsis so that everything flows through it. The laser also has an impact on the vagal system, which comes down and makes your stomach have stomach acid. And it also comes down and it activates your liver so that you get phase 1 detoxification. So it's helping your liver, it's helping your stomach, it's helping your guts, it's helping all of these things. And a lot of that has to do with cellular health, but we also know that with laser, we can actually control vagal output. We can control sympathetic and autonomic tone. I mean, this is a big, big deal. When you start adding all this up and you have bad parasympathetic and vagal tone, and your cells are failing, and you're not detoxing well, and you're not breaking down food, that's probably the beginning of 6 or 7 of the top 10 most chronic diseases right there. We can also get environmental toxins. Now, this is a bigger problem than what people think. Look, we can get heavy metal toxicity, we can get mold toxicity, and then of course we can get infections and stuff like that. All of these things right here in this top tier can actually start to damage genes. So your DNA responses, if this is a DNA response right here, we know that we have to make messenger RNA, and messenger RNA is a whole study. So we actually can look at the genetics now. We can now look at messenger RNA, and we can now look at transgenomics, where this is how all of the genetic expression will change if somebody becomes more unhealthy or if they become more healthy. So if you're less inflamed, have more energy, you're not as toxic, you're detoxing good, you're breaking down food, and the biggest thing, you're moving and you're exercising. If you're doing that, your genetic code and the mRNA and the transgenomics changes and becomes a healthier state. So you're not as genetically ill, genetically prone for inflammation, genetically prone to not fight infection. It is a game-changing thing. And look, people always ask me, like, what are the things I can do to just live longer? Exercise with resistance training. All-cause mortality goes down. If you lose your muscle mass, you're going to die faster, you're going to get sick easier, and your brain is going to deteriorate. At least 3 days of resistance training a week. When you do 4 or more, there's a law of diminishing return on that. But look, resistance training, not just a walk. Walks are good, but resistance training. Figure out a way to get it in your life, okay? Now look, if you really want this to go sideways, metabolic health. So if you have insulin resistance, blood sugar resistance, this creates inflammation. This creates a situation where cells do not get energy. Please, if you have diabetes or insulin resistance, get it under control. Because if you do not, again, your brain is going to die faster. If you do not, then you're going to become inflamed much easier. Also, your cholesterol is going to go crazy. Your triglycerides are going to get really bad. Your blood pressure is going to go up, and a lot of things are going to go sideways. So keep your gut healthy, exercise, make sure that you don't have diabetes. And look, I'm just telling you, this is a big, big deal. I'll give a lot of nutritional paradigms and laser paradigms, or sort of a treatment methodology that we can kind of deal with all of these systems. And then, of course, I mean, we could talk about hormone regulation all day. I mean, we have situations where guys, they start to lose their testosterone. It is an epidemic right now. Testosterone levels are plummeting, and we could blame it on all kinds of things, but right now it's a big deal. Of course, there's all kinds of environmental endocrine disruptors for females. The amount of estrogen dominance in females is just really changing brain and creating mood disorders. Your estrogen has everything to do with your serotonin. We know that estrogen and progesterone ratios and balances are really skewed right now. Estrogen dominance is enormously bad right now. So I mean, at least in my practice, we have a lot of people that are getting insulin resistance, and that's creating significant estrogen and testosterone ratio imbalances. So point being is, whenever there's hormone dysregulation, estrogen deals with serotonin, progesterone deals with GABA. We know that testosterone deals with dopamine. There has to be a good interconnection with all these things. If the brain is changing, hormones will change. Of course, there's menopause that females go through. There's sort of an andropause that men go through. But look, if you have environmental toxins, it changes hormones. If you have gut issues like with beta glucuronidase, then it's going to change your hormones. If you have autoimmunity, it can change ovarian and testicular function. These all go together. When you start looking at this story, you can't really just do one. You need to start to learn to do all of them so the big picture will start to manifest for you. And when you do all of this, your longevity is much better. The ability to get rid of dying cells is much, much easier to do. And you won't have as many neurological, degenerative, and deteriorating types of disorders. You know, when you look at this, the amount of dementia, the rate has changed significantly since COVID. And I'll talk a little bit about COVID in this, but I'm not going to beat that drum to death. But I will tell you, COVID has changed it. The average age of onset for dementia in females in my practice is now 52 years old. Those are the ones that are coming to see me. That's scary. The percentage of people that are going to, you know, experience dementia is going up significantly. But the scarier thing is, I mean, it's different when you're in your 80s, right? But when this stuff is starting in your late 50s and early 60s and it's becoming more prevalent, let me tell you something. Laser your head, please. Let me just tell you the formula. It's really easy. Exercise with resistance training. Please quit eating so much sugar and laser your head daily. If you don't do anything, do one thing, and that is get a handheld and violet and green your own head 7 minutes a day. If you do that, you will keep the mitochondria more resilient. You will not lose your energy kinetics. Your cells, the microglial cells, will not become so stabilized that you get chronic, genetically turned on inflammation. And then when you exercise, you'll get that plasticity that keeps it all going. And when you do that, here will be the curve. Most people, they kind of curve like this on their neurological health. You know, they're up here, and then over time they do this. If you don't do this and you get inflamed and you lose energy, you're going to do this. With the laser, there's a better chance, a higher probability that you're going to age like this. Stay up here, please, because once you get down here, it is very hard to get it back. Okay, it is very, very hard to get it back. So I know I spent some time on this slide, but hey, look, I want everybody to start to understand what real integrative healthcare is. You know, it doesn't matter if you're a chiropractor, medical doctor, acupuncturist, it doesn't matter what you are or really what specialty you are. You can't just completely specialize and do integrative or functional medicine care, rehabilitation, or whatever the case may be. If you do female hormones, you have to learn about the brain, you have to learn about detox, and you have to learn about gut, or else you're not really doing female hormones completely. If you're a brain guy, you have to learn about hormones, because hormones, you're a slave to your hormones. You're going to do what your hormones kind of tell you to do, right? And then if you're an infectious disease doctor, then you have to understand, you know, gut health, hormonal health, and everything else. So what I'm trying to say is this is true integrative care. And in the middle of it, I try to look at the tools that will hack in and help every section. I have laser to fight infection. I have laser to help mitochondria. I have laser to activate brain. I have laser to reduce inflammation. I can laser over my liver. I can laser over my gut. I can laser over my spleen. I can laser over my lung fields. I'll show you a study here in a minute if we get to it, where they actually lasered over the lung fields with COVID, and it actually changed mortality, morbidity. It got people off ventilators faster. And this was just done with red laser. It didn't even use violet, right? So it's the handiest tool for integrative care, and this is what integrative care is really kind of looking like here. So the mitochondria, this is so important right here. I mean, this is, you know, mitochondria makes ATP, and we are going to roughly make our weight in ATP per day. It's really about 80% of our body weight. That's what we're burning through in order to stay alive, okay? So we have ADP coming through here and turning into ATP. Your brain is going to use like 26% of that, okay? And so the more unhealthy you get, the less of your, let's just say, your body weight of ATP you're going to make. When you're about 30 years old, 32 years old, it's going to go down 1 or 2% per year. And so we age. Now, some people will go down 3 or 4% per year. When you add that up, you die faster. Your tissue breaks apart quicker. Your bone integrity becomes different. Your brain integrity becomes different. Your heart elasticity becomes different. Everything ages much faster. So one of the goals is if we want to create a situation that can heal and not die fast, make sure the mitochondria is healthy. Here's the thing, lasers are, your mitochondria is an organelle that is basically a structural, it is light encapsulated in an organelle. It is bioenergetics. Bioenergetics is fired by light. We are out in light every day. You need to be in light. You can't be in the dark all the time. Light and the entire spectrum is what really creates bioenergetics and allows this entire mitochondria to utilize nutrition, to utilize protons. So photons from light fire protons in the pumps and allow electrons to give us energy. What Erchonia has done is it's taken just general light and structured it and really keyed it in to usable wavelengths that are specifically designed to almost be medicinal for the mitochondria. You cannot, light is the most important thing for bioenergetics. So having said that, that's why laser is so important in the breadth and depth of the material that we're talking about here. So when we give you mitochondria health and we give you laser and we give you nutrition, I'll put it all together for you and just say, hey, if you want your mitochondria to make it, this is how you do it right here, okay? It's going to enhance the cellular resilience. I love this. I treat a lot of neurological disorders, but I also treat a lot of people dying from infectious diseases. I also treat a lot of people with biomechanical problems. Mitochondria is in the center of things. Now, I will tell you, you want to help somebody's mitochondria, but if somebody has a bad infection, it has to go. If somebody has a bad thyroid, you need to fix it. If somebody has bad insulin resistance or diabetes, you got to control it. In other words, the things that are screwing with the mitochondria, you have to treat them sometimes first or at the same time, because if you don't, all you're doing is buying yourself time. And let me tell you, sometimes that's important. Sometimes you're using the laser on the brain per se to maintain its viability and functionality while you're getting their diabetes under control, or you're getting their thyroid managed, or you're getting their gut healthier, or you're getting them to move so they're actually stimulating their brain to have plasticity. So there's a lot of reasons, but so again, you're going to produce just for the brain 26 to 33 pounds a day, okay? And listen, ATP decline is probably, for whatever reason, whatever the cause of this is going to create a situation where you're going to go into cognitive decline much, much faster. So this is kind of the way it works. It's interesting. Your brain is so crazy efficient. Of course, it will utilize glucose, but it really does well with ketones. Okay, so if you're eating too much sugar, you got to remember something. Your brain does not need insulin to get glucose in a neuron. It doesn't. Insulin does different things. It works on something called GLUT 1, 2, 3, 4, 5, and 6 receptors. That's a whole different story. But if you have diabetes, for instance, and your blood sugar is up, it will end up going inside a neuron at a rate that is higher than it should, and it causes inducible nitric oxide damage, free radical damage, and it changes the inositol levels to where it can change myelin, and it starts to swell and get pressure, and it'll destroy the cell. So if your glucose is up around 120, 130, 140, 150, if your A1C is high, you're killing neurons, okay? So glucose has to be under control. But if glucose is not readily available, your brain will shift to ketones, and it does a very good job, okay? If that happens, it'll shift to lactate. And what's interesting with lactate is if you want your brain to utilize lactate, everybody, you can just, during a break, stand up. You can just do squats as quick as you're just standing there. Just do squats for about 60 seconds. Your brain will shift and your cells will shift to a lactate mechanism, and it fires off mitochondria and neurons, and it helps them rebound. It will increase your arousal rate, and it'll increase your attention. So about 3 times during the day, I'll just get up when there's nobody in the office, obviously. Sometimes I'll do this with my patients when they need it. We'll just sit there and do squats. It's really interesting. Some of you will do it and be sore tomorrow. That's how out of shape you are. It'll also work on aminos and then also on glycerol. Basically, the brain will work on any of this, okay? But when we do this, we get good mitochondria. And when we get mitochondria this good, we make good ATP. It keeps the structure of the brain or whatever organelle, it keeps it intact. It helps your DNA become stable so you don't get that mRNA fragmentation. It allows the cell membranes and the blood-brain membrane to become stable, and you don't get as much reactive oxygen species. This is crazy. So when this happens, neurons start to connect, they become more functional, you get neurogenesis, you get coherence, and then when you activate it with exercise, you get good nutrition and good hormones to make neurotransmitters. You get good things for nitric oxide, like for instance, nutritionally, beet juice extract and vinpocetine and laser brings blood to the area. Your glial cells don't make inflammation, and then you end up getting a good blood-brain barrier. All this stuff fires in to make this nice and plastic. Neurogenesis occurs, coherence occurs. Coherence meaning the brain starts to connect together to work efficiently. And this is what gives you plasticity. And when plasticity occurs and coherence occurs, you will control your thyroid, you will control your gut, you will control collagen synthesis for skin and hair, you will control all the systems. In other words, nothing escapes surveillance from your brain. And I'll show you what that looks like here in a sec. Okay, so how do you know if you got a mitochondrial issue? I mean, how do you know, really? Let me just kind of give you some examples of what it looks like if your brain is not doing what it's supposed to. So you have low energy very quickly. These are one of the ways you can know if your mitochondria is kind of failing is if you start reading a book, you fatigue very quickly, okay? If you're driving, you fatigue very, very quickly. Just doing things that requires ocular and mental kind of stuff. It's not, and maybe your exercises are poor, but you could be out of shape. There's a lot of dynamics to that. But just thinking, especially when people say, man, I read, I go straight to sleep. I'm like, uh-oh. Okay, so fatigue, exercise intolerance, muscle weakness. Now, cognitively, these are people that have brain fog. And so what is brain fog? It's almost like a clear thought. It's kind of having to go through mud. Or when you're trying to focus on things, it's almost like you can focus on it, but then it jumps to another topic real quick and then comes back. Brain fog is AKA, I have inflammation and I have poor mitochondria. So that can create concentration problems. And when we can't keep our focus on something long enough, we'll have memory problems because we're not assimilating information very well. Processing speed is slower, and headaches and migraines are a big one here. All of these things are signs that your brain is probably dying faster than it is recovering. And of course, this can cause some mood changes and so forth. So the metabolic stuff is if you have unstable sugar. So if you get really angry when you're hungry, blood sugar, could potentially be imbalanced, maybe low. If you eat and want to go straight to sleep, that's an insulin problem. But again, it's a metabolic instability. It's cellular instability. Those are just things that I say. It's like, hey, if you get really angry or really tired because you missed a meal, that could be a problem. You can see this whenever I'm lecturing. Right after lunch, you can see the people, they're kind of doing this. And those are the ones I'm like, that's insulin resistance right there in all reality. So you can kind of watch those things. And then of course, if we have adrenal issues, for those of you that do hormone stuff, and again, I don't know everybody in the crowd, but if you're doing hormone stuff where you're dealing with estrogen, progesterone, and you're dealing with androgens, remember, before you do any of this stuff or while you're doing this, you have to look at the adrenal glands because the adrenal glands are precursors to all of these. And if you're doing stuff with estrogen, testosterone, and progesterone, you have to look at their metabolites, the 4,16-hydroxy, methoxy metabolites of estrogen and progesterone, and also the things that testosterone breaks into, and looking at the reductase levels, because if you're not metabolizing hormones, it's just as bad as if you're not making hormones. And none of that will work if your adrenal glands are completely failed. Take, for instance, females, when they go into menopause, postmenopausally, most of their hormones that they have are going to come from adrenal function. So if your adrenal function is down, your brain's going to suffer. You're not going to make up any backup or reserve hormone for that time of your life, and you're going to really, really, really fail. Okay. And then cardiovascular stuff. Blood, you guys, you have to maintain blood pressure, or else you're going to get vascular dementia and vascular changes. Laser is really good for controlling nitric oxide. I laser over my heart every single day. There's great laser, and I like violet and I like red. Okay. Because it helps with nitric oxide, it helps with coronary artery, and it helps with the mitochondria. Cardiac tissue is dense and rich with mitochondria. So my laser regime every day is from head to heart. And those are the things I do. Look, my father passed away in his late 40s from heart attack. And, I don't want to, the apple doesn't fall far from the tree in regards to some of the problems that people may experience. So I'll do that. I watch my cardiovascular system and I watch my brain. Those are the things I want to preserve, right? Of course, I don't want any problems. We're all going to have some pain. Our hormones are going to shift and things like that, but I don't want to have artificial support for my heart, and you can't replace a brain. Okay, you can't do it. And I'm going to say it again. I'm going to sound like a broken record. If you're not lasering and taking care of your brain, you remember every time you lose a brain cell, a neuron, they don't undergo mitosis. They don't divide, separate, and you make new ones. So when it's gone, it's gone. Yeah, you may have neurogenesis, but good luck. Because if you're not healthy enough to keep them alive, you're probably not healthy enough for neurogenesis, all right? Some other symptoms here. Here it is, hormones again. I was just sort of like, talking before I even got to the slide, but you got to have adrenal function. You have to have thyroid function. These guys right here have everything to do with sex hormones, and then vice versa. 20 to 30% of my patients that I have is thyroid disorders, and I treat a lot of patients with hormone dysregulation. Men, a lot of them, and females. It's, I try to make everybody get that transition between 47 and 53 to be as smooth as possible. And when you do that, you're a very fortunate person if you have somebody that will coach you through that, being female. Detox is going to make, if you were toxic, and I wish we could go through all the labs that you can look at just to see toxicity. It's so easy. You can just see it in a CMP, like a regular blood panel. If your GGT is abnormal, if your liver enzymes are abnormal, if your albumin and globulin ratios are abnormal, look, there's going to be a problem. When you have gastrointestinal and detox issues, you're going to have mitochondrial problems. People have to take a poop. If they are not, then there is going to be mitochondrial problems, okay? And if you're not using the bathroom regularly every day, you need to find out why. There's a problem. You need to find out why, because it could be signs of bigger things, a whole lot of things. And so that is one thing that, it's just natural. Everybody does it, and you need to be doing it. Okay, so if you don't have good mitochondria stuff, and again, I'm going to get into what this laser does for this, and what laser does, and what nutrition does, and what physical activity does. Those are important things, okay? If you just say, I'm a mitochondrial doctor, you're covering just about every system. You're going to slow down brain death. You're going to slow down metabolic stuff that can lead to brain death. You're going to help with autoimmune disorders by regulating the immune system. And when that's not regulated, you're going to have inflammation and more mitochondrial death, and you'll get chronic fatigue, chronic disease. You'll be at cancer risk, and all-cause mortality will go up, and that's where we are at. A laser helps with that pie of chronic pathology, and the mitochondria is right in the center of it. That's why I always put this at the beginning of this talk. So here's what a laser is going to do, right? So here's our reference here. I try to give good references for these things, but look, when you utilize laser, let's just say we're using it over brain right now, you're going to increase nitric oxide. And what that means is that if this is a cell, you're going to get more blood to that cell, which means the nutrition gets there, the oxygen gets there, everything that the cell needs to live is going to be enhanced because it gets there. And you're not going to die because of ischemia. Check mark. Violet is enormously important here. Violet is my favorite wavelength by far. Blue is also really interesting, but that's obviously not a wavelength for this discussion. But violet is fantastic, guys. It not only does it kill as an antimicrobial, but it's huge for reducing fibrotic scar tissue when things are healing, like muscles, and it gets blood to the areas where you need it. Foundation, first and foremost. Like if somebody's laying on the side of the road, you always see if they're breathing and check their pulse. Those are the most important things. Nitric oxide is absolutely important. Now, there's a product called Neo 40, Neo 40, which has beet, it has nitrous sulfide, it will increase nitric oxide isomers. Laser, especially violet, will increase nitric oxide isomers and fire up the electron transport chain, and you will get a better blood response. Make sure that somebody's not anemic, make sure their iron is good, their B12 is good, and that their red blood cell count is not low, and their hemoglobin is not low. If you get all those things going, you have just conquered a lot of things with chronic, with life. When people come in and they're anemic, have small vessel disease, and their B vitamin status is low, and their iron is deficient because they have poor absorption in their gut, they're going to have a very, very difficult future. Okay, cool. Laser helps with ATP synthesis. I told you about that, right? You know, we're making about our weight every day. And if we make ATP, I mean, if you wanted somebody, like if you had special powers as an evil villain, I would be ATP guy. Meaning like I could just point my fingers at you and go like this and you would stop making ATP and you would just fall over dead. It would be the most sinister super villain power on earth if you could just stop ATP synthesis. A laser does the opposite. It enhances ATP synthesis. And if you don't do this, the cells die and they go boom, you get apoptosis. And then all of the transcription factors from the membrane all the way into the cell, all the way into the gene, all of these transcription factors are activated by laser. And that happens by controlling ion concentrations. So a laser controls the transcription factors, activates ion concentrations, activates the growth factors, causes intramitochondrial signaling so that we actually make ATP. This thing doesn't die, and it brings blood and nutrients so that the cycle continues and goes and goes and goes. Listen, laser your head 7 minutes every day. Laser it. Get violet. Green is fantastic. I'll show you why green is great here in a second. I'm going to try not to be too redundant over things that Dr. Aruka might have talked about, and I might a little bit here when we start talking about mitochondria, because it is a bit of a center of the conversation. So to make this kind of like, to kind of sear this up a little bit, a laser will increase the ATP. It will suppress inflammation. It will deal with antioxidant production so the cell doesn't die like I just talked about and decrease that oxidative stress. It will activate your basically your mesenchymal stem cell, or you know the progenitor cell turning into whatever tissue. It will enhance that capacity. So if you look, let's say this is in a joint, okay, and all the collagen, there's this thing called a niche, and it just looks like a bunch of wires that are there, and it's all this connective tissue, and then a cell will come and just sit there, and its interaction with this niche will make it turn into a chondrocyte, or it'll make it turn into whatever, or a neuron. So all of the niches and the extracellular environment that is around there and the lining of the blood vessels will allow these stem cells to proliferate. It's really crazy. If this right here is a blood vessel, stem cells will hang out right here on the wall, and they have a little finger or a little tentacle that's going through here and that's monitoring what's going through the blood. And when it senses a danger response or some need, it jumps into the bloodstream, goes to where that tissue is, hangs out, and then it turns into whatever cell it needs to. As you get older, these die off. There's only so many generations or replications or copies of those. When we give somebody stem cell therapy, we're basically replenishing these cells and giving new energy states. And not only are we giving new energy states, but we're giving cells that have the ability to make copies again. As we're doing regenerative medicine and we're utilizing stem cells, or we're utilizing exosomes, or we're utilizing any kind of PRP therapy, we will literally get the substance and laser it. We'll put a laser beam through it on certain settings to activate the cells to get them to start to transform and get ready to enhance into new tissue. And there's actually literature on that, so it's really cool. But laser also enhances growth factors and prevents neural death, and it's also it stops the neuroexcitotoxic overactivation of cells that make cells die. It increases the opioids, of course. It increases mitochondrial fusion, not fission, which is important, right? Because if not, you're going to walk around with a bunch of dead mitochondria and a bunch of dead senescent cells or zombie cells, right? The people that do really good with all these cold plunges and saunas and all that stuff, one of the things that's happening is they're getting rid of dead cells. It's getting rid of senescent cells, and that allows for the production of newer cells to sort of be enhanced, and it also allows damaged cells to repair. And what all that stuff is doing, and all that biohack stuff is doing, is it's activating heat shock proteins and cold shock proteins. It's forcing resilience in your mitochondria, get more robust, and you get rid of the old dead stuff and you kind of start over a little bit. So people that do that consistently, they don't have to deal with dead tissue as much. If you enhance that with laser, nutrition, and exercise, it's enormously powerful, okay? People that are like, yeah, I just jump into a cold ass tub of water every day, and they don't exercise, they don't have a good diet, they're not using a laser or anything else, all they're really doing is just jumping into a cold tub of water every day. I don't know that it's really doing much of anything other than just, you know, making them look silly. But so increasing blood flow, speeding up metabolism or controlling metabolism. And of course, laser causes fat cells to dump their content. This is so important. Violet does it and green does it. So here's fat. And lasers have a way of making adipopores in fat cells. And when this happens, you dump out the internal contents. And this is why this is so important, because fat holds on to excess hormones that are not usable. And it also holds on to toxins like heavy metals, environmental toxins, and mold. And it holds, and it really, whenever it gets enlarged and fat hypertrophies and you get fatter, it is really creating inflammation. So you start releasing something called leptins, and leptins go up to your brain and they say, hey, look, man, quit eating so much. And then you make adiponectin, and adiponectin comes out and it says, hey, inflammation, I need you to go down, because we know fat creates inflammation. So the adiponectins have to go up, and leptins will start to go up to say, quit eating. But your brain will get resistant and say, I don't want to listen to you anymore. And so your leptins go up and up and up and up, and your adiponectins go down and down and down, and your fat cells get bigger and bigger and bigger. So what happens is the leptins, when they go up, they go into your joints and make them inflame. And when your adiponectins go down, it doesn't stop the inflammation from going into the joint. So you get inflamed knees and inflamed fingers, and you get bigger, fatter, your brain starts to go down in function, you get metabolic disruption, you get depression, you get hormone dysregulation, and a lot of it has to do with one thing. Your fat cells are getting bigger, and they're controlling your inflammatory biochemistry, your hormone biochemistry, and your neurochemistry as well. Look, when I put people through emerald treatments, or whether we're using violet or green or even red, one of the things I tell people is, I'm not worried about your weight, we're worried about fat content. We're wanting to shrink this stuff, and we're wanting to get the stuff out. I do detox my patients when I use those lasers. And it is really important, I think, to do that. I mean, they have to stay hydrated, and we do lymphatic massage and all that kind of stuff. But when they start getting fat cells that shrink and we get all the crap out of them, people feel better. It's not just about the way you look. Obviously, that's cool and important, but it's also the way your body's feeling. It's the inflammatory burden. It's what you're going through. And look, when you get bigger and you get more obese, what happens is it messes with your immune system. It messes with your resilience. Look at the people that died from COVID the most. It was the obese. They were already inflamed, so the storm kicked in faster. They were already immune dysregulated, and they already had an insulin mechanism and a tumor necrosis factor mechanism related to insulin that was screwed up. So if their interferon was not good enough to get rid of the virus, they caught a storm much faster, and they had to get ventilated easier. So I'm just saying, let's go back to the things, and I'm just giving you these little nuggets because I don't have a lot of time with you. But if you want to live longer, resistance training every day. Don't care how you feel. You're like, oh man, I got a bad knee, a bad elbow. Then exercise the other knee and the other elbow, man. Do what you can do, okay? Eat less sugar and eat more protein. All right? Make sure that your body mass index is under control, because that means that insulin is better. That means that inflammation is better. So if you keep your muscle tone, you will live longer. If you start getting softness, lose all glute tissue, and start losing shoulder and hip muscle mass, these are all signs of, again, disease later on down the road. So exercise and keep it going, control your body mass, control your sugar and protein intake, and laser, I will always say this, laser your brain. I'm trying to collect every paper I can on what laser, or just the photochemical effect and low-level laser is on brain. I cannot keep up with the literature. There is so much. There is so much on depression. I'm not talking about the government putting a stamp of approval on it that it should be the form of therapy. I'm talking about the research literature saying this changes mood, depression, anxiety, and function. It increases blood flow to brain so cells don't die. It fires up mitochondria so you have the energy to have neuroplasticity and neuroconnectivity. It enhances your blood-brain barrier so that this thing is not a very porous system where everything's getting through and beating it up. All the literature says that if you spent your whole life trying to read it, you would never even get through a tenth of it, okay? Do it. Keep up with these things. I guess I'm giving you a pep rally right now, but I think it's an important pep rally because listen, you're all clinicians and you're all helping other people. You have a life that needs to be long, fruitful, because other people are depending on you so they can stay healthy. So yeah, it's important. And look, this is really cool. And this is the thing that you may have seen already, but so just bear with me as I go through this a little bit. So this is the mitochondria. So we're looking at this little section right here. I've been talking about the mitochondria for the last, 45 minutes or so, okay, bam. So this is we have this outer membrane and we have this inner membrane. Inside this inner membrane, we have complex 1, 2, 3, 4, and then finally you have ATP synthase. So picture this as a little wheel that's turning and it's taking ADP and recoupling it into ATP, and then ATP makes everything go, everything, right? Remember, we're making close to our weight in ATP per day. If I was a supervillain, I would say, hey, ATP synthase, stop. Everybody would just drop dead, okay? Photons from light come in here. Protons from diet come in here. And photons give you the ability to utilize protons to slingshot electrons through this to make this wheel turn. That is the electron transport chain as simple as I can make it. And check this out. The rate limiters of the whole thing, the very first two that get the party started, are controlled by violet. So remember when I told you that the mitochondria is a representation of light? The electron transport chain is basically it is a chemical reaction of structures that are a solid mass representation of violet light. Your mitochondria is an organelle's representation of violet light. The mitochondria is a receptor, an antenna for violet light. And when it comes in and it activates these first two complexes, it allows you to activate complex 4. Red light has been very active for bringing up bringing up the speed complex 4 to activate ATP synthase. So red has worked, assuming that complexes 1 and 2 worked. The reason why green is now so unbelievably powerful is it activates complex 3. So complex 3 allows the first two rate limiters to connect to 4, which is the initiator of ATP synthase. If there is a problem here with cytochrome C within the cell and this is not working well, green will switch that on, and it allows the two waveforms, red and violet, to be coherent and work inside the cell. This is crazy. This is the coolest thing. Now, I will tell you, red will work on all of these complexes. I'm talking about a propensity of complex inside the mitochondria. This is, and so what will we have in 2 years? Who knows? I'm sure there'll be something else, but this is what we're starting to do. We're starting to understand not just low-level laser therapy and not just red, everybody's doing red, but now we're understanding how violet plays in this and how violet and red work together, and then how green works with everything else involved in this. So this is big, 405, this is really big, 520 for green, and then of course 635, what we've been using. Now, low-level laser, it'll go from the low 630s up to about 810. I don't like a lot of stuff beyond 810 because in the brain, for instance, infrared will start to activate these things called NMDA receptors, and it can enhance excitotoxicity. I don't like it. I don't like infrared on people's brains. I don't like infrared saunas on the brain. I don't necessarily mind it on the body. I think it does some lymphatic work. I don't want it on my patient's head, okay? It does not take a lot of power. The electron characteristics have an enormous amount of electron voltage with an Erchonia laser. It's huge. The electron power is huge, but the milliwatts that this thing is pumping out, the higher the milliwatts, the more it's going to hit the skin, vibrate water molecules, and create heat. It lowers penetration, and you don't get this mitochondrial effect. So it's a really expensive hot pack. look, with an Erchonia laser, you're not going to perceive heat. The lower those milliwatts are, there's a sweet spot there that we have programmed in our devices, and it allows for higher penetration into the cell to get the photochemical effect within the mitochondria that we need and control cytokines, okay? There's a lot of lasers out there, and I'm just gonna say it, there's a lot of lasers out there that think they're really cool because they can change like this low level setting up to like an infrared setting. But the other thing is the amount of milliwatts, they can actually program this laser to go from low milliwatts all the way up to like 400 milliwatts. They're allowing lay people out there to shift this up. And if they're shining this on their head or over their eyes or different things, it's dangerous, okay? Find out what the settings are of the laser, set it, sell it, and that's what it is. Of course, we can change the frequencies, the pulse, you know, the actual cycles per second that the laser is discharging. That's one thing. We know what Erchonia did is they said, these are the best settings. Let's use this. This is what the research shows. If you talk to the people that are really involved in research at Erchonia, they'll be like, look, if there was a better setting that we found in the research, we would use that. So I think that's important to kind of understand. It's also a coherent wave. There's also no scatter, and it's actually a true laser. It's not just an LED. So those are all important things to kind of understand. And that's really my spiel on mitochondria. And I told you that's the epicenter of all these things. So I kind of talked to you about this. 635, this is an anti-inflammatory interleukin, so it's super duper important. 405, this is the violet, and I told you it helps with nitric oxide, it helps with skeletal muscle fibers, so when you're recovering, you don't get scar tissue as much. Green is really important here. I told you this, but we're going to find out real soon that it's going to help with osteopenia. And it's going to help with peripheral neuropathy. I'm telling you, if you want peripheral neuropathy to probably be doing really well, if this is a peripheral nerve right here, violet will bring blood to this so that it doesn't become hypoxic and you get paresthesias. Green and red will help with action potential so that you maintain viability of the neurons that are actually firing into that peripheral nerve. And also violet is going to help with myelination and nerve repair. So peripheral nerve, true peripheral nerve, I mean, they got all kinds of stuff. You know, there's different kinds of electrical stimulation, there's shockwave therapy, there's all these cool things. You can't be diabetic because it will screw things up. You can't have thyroid disorders, it will screw things up. But violet, green, and red at the perfect power with the perfect dose with the perfect electron voltage, you will probably see studies that will come out in the future that will show it is superior with helping peripheral nerves. It will be a combined effect. We have to do something more than just giving people gabapentin, Neurontin, Lyrica, or antidepressants to help with neuropathy. You just can't stay on that path because there's an underlying system of bad health that's causing this, okay? So this again is just interesting. So I have a lot of literature. I took some of the literature out because I don't want to sit there and just make this a review paper session. But there's a lot of literature that shows everything I just told you, paper after paper after paper after paper that supports what we just talked about. This is another picture of this, and I'm going to talk about what some of the supplements are, but like complex 1, okay, so what activates this? Violet, and we know that glutathione and ergothioneine and nicotinic riboside, or NAD, stimulates this. But if you've been exposed to pesticides, insecticides, if you're taking diabetes medications, NSAIDs, Tylenol, mold, seizure medications, or if you've had surgery, it's going to start to shut down complex 1. So if somebody says to me, hey man, I'm really hurt, I blew up my knee, I got to have my shoulder, my knee replaced, I got to have surgery on it, and in the meantime I'm taking a bunch of NSAIDs, I'll say, okay, great, I'm going to laser your knee, but I'm also going to laser your brain after surgery, because I don't want your complex 1 to shut down from the anesthesia, and I don't want complex 1 to shut down because you've been taking a bunch of NSAIDs, and I already know you live in a moldy house and you were taking tons of Tylenol, so I'm going to actually laser their brain before and after surgery, and then of course I'm going to laser their knee, do everything I can through an AK mechanism and adjusted mechanisms to activate all of the muscles around that knee, to activate the low back, to activate that knee, just to actually adjust their foot so that their arches don't drop that will screw up that knee. So you see now how we have to keep brain health intact even if somebody's having knee surgery. And by the way, all of these muscles around the knee, if this is a if this is I'm going to draw a really bad knee joint here. If this is a knee, this is terrible. And this is a thigh. This is a gastroc right here. And then this is a foot. If you want this knee to become stable, you're going to have to activate quadriceps. You're going to have to activate popliteus. You're going to have to activate hamstrings. You're going to have to control the peroneal muscles. You're going to have to make sure all the muscles that are crossing this joint and even others that are up here in the hips like psoas, iliacus, and the adductor musculature, and even the glute medius, they all have to be activated so that you have a good kinematic biomechanical chain. Look, here's the thing. So this leg right here, let's say that this is a right leg. It is controlled by the right cerebellum, and it is also controlled by the left cerebral cortex. So while I am turning on these muscles and doing things, I am stimulating the contralateral motor cortex, the ipsilateral cerebellum, sometimes the lower back, and then I'm doing everything I can to turn these muscles on. I will vibrate the muscle, and then that causes an afferentation to go all the way up to the brain, and then I will stimulate the brain to receive that afferentation, and then do everything I can to start to stabilize these systems. And when you activate them, they now become more stable. So your rehab is you can use a therapy band, but you can also stimulate that cerebellum at the same time and that cortex at the same time. That's why an FX is amazing. You can just put it on and people start doing their exercises. You can dynamically turn on these reflex patterns that are highly neurological and highly segmental, and then also peripheral. So cool. And then if somebody has to do something like go get surgery and they can't do all this, then you can just laser straight through the joint and help control pain, help control healing, help control, blood flow to it, help reduce, skeletal, all the kinds of, fibrotic tissue. But then you can also keep their brain healthy by making sure there's good nitric oxide to it and making sure that it's being activated in a way to where if you don't move this leg and you don't get the afferentation up to the brain, this part of the brain will start to shut down, the cerebellum and the cortex, and it will rewire, and you don't have the connectivity and representation of the entire limb. So if you will laser this and have people visualize their leg while they can't move it, you will keep its presence in the parietal lobe. Man, I just went through a lot of rehab, but that is some fun stuff. I wish I could show you all that hands-on, because that is important stuff. And think if you actually don't exercise or move and you just sit on the couch all day, your entire brain says, I guess the legs and arms are gone. So let's just shut it down. And when you do that, you don't get autonomic distribution of blood to your limbs. You get it to other areas, and it starts to distort your muscle tissue. It starts to change your fat to muscle distribution, your BMI. Like, you'll start to get skinny fat. You'll lose all your muscle tissue, and it's not an appearance that you want. All right, so just kind of going through this, I put down like all the different medications that actually will impact these complexes. We have most of them mapped out, and we're making a very long and exhaustive list. Because what we're going to find out pretty soon is that the medications will alter the electron transport chain. And if you're on diabetic medications, we know you're going to shut down certain complexes. So you should be lasering your brain every day if you're on those medications, because it's counterproductive to your mitochondrial longevity. Whew, okay. Okay, let's skip that. Now, I will tell you this real quick. So this is complex 1 and 2 and then 3 and then 4. And remember, violet is right here. Now, I'm just going to tell you this because this is something that's out there and all the biohackers are doing it. It's methylene blue. A lot of people are taking methylene blue for health, brain health, mitochondrial health, and everything. Remember, violet, or in the blue spectrum, fires off these first two complexes. Methylene blue allows these first two complexes to connect to 4. And methylene blue is a nutritional, basically a solid substance that does the exact same thing of blue violet light in the mitochondria. It connects these things and reduces reactive oxygen species so that you make ATP. There you go. That's what methylene blue is doing. It's also an industrial strength dye. And I'm also, I'm sort of out to lunch on it. There is some literature coming out that shows that post-mortem, as they actually dissect brains, they're seeing that some of the brains are stained blue. Now, I don't know if that's, I got to look into it a little bit more. That may not be damaging, but I just don't want that, okay, personally in my life. But I do have a paper that shows that violet light with methylene blue works better for oxidative stress and mitochondrial health than either one of them by themselves, okay? So interesting stuff. So if we control the environmental triggers, if you exercise, if you take care of yourself, if you control your blood sugar, if you stay away from a dirty environment, it's going to deal with oxidative phosphorylation. This is fancy wording for making ATP, all right? And if we don't get all these polymorphisms, meaning our DNA is not screwed up and our messenger RNA and transgenomics messed up because we're healthy and we're exercising and we're getting laser-based therapy, then here's the deal. We don't get as much oxidative dysfunction. You know, we don't get decreased energy. We don't have altered genes. By the way, if you're making good mitochondria, your mitochondria, making ATP allows your DNA to not duplicate or delete. And if it duplicates or deletes, then your messenger RNA becomes of a different kind. You're now making messenger RNA that is an expression of a gene that is duplicated or deleted. So now it's a mutated messenger RNA strand, and that will then go off into infamy, and it just causes all the cellular processes downstream to become screwed up. So listen, if we keep this mitochondria intact and we make ATP and we're exercising, using lasers, using nutrition, we will control immunological disease. We will potentially reduce our chance for cancer, metabolic disease, aging. Remember, senescence, you will not have as many crappy dead cells and mitochondria floating around. Apoptosis, you will not have so much cellular death. And neurodegenerative stuff will be a thing. Again, do you want to be an 80-year-old in a 60-year-old body, or do you want to be an 80-year-old in a 95-year-old body? I mean, I don't know. Look, I'm not saying I want to live forever. I just want to say this. I want my story from A to Z, I guess, to be the best it can be. I don't know. I'm not trying to rhyme or anything there, but look, it makes sense, right? If I'm going to live to be 85, I'd like to have 85 good years, not feel like crap when I'm 58 and just struggle to the finish line. It's not a good idea. I'm giving you part of a recipe here to potentially circumvent some of that, and you don't necessarily have to go through some of it. So again, with good laser, good nutrition, good exercise, we get this fusion, we don't get this fission, and we end up getting what we want. And we want fusion proteins in these big, fat, nice, beautiful mitochondria. Woohoo. So here it is. I told you about laser. You have to have violet. I love violet. You need red, and green is very, very nice as well. Okay, listen, laser is a staple, but you can add CoQ10 into that. I recommend 100 to 200 milligrams a day to support ATP production. It's going to help your laser. It's going to help you not die as fast. It's going to help your heart. It's going to help your brain withstand all these things that are getting hurled at it every single day. Magnesium helps control excitotoxicity, and the threonate helps with GABA. It crosses the blood-brain barrier, helps with ATP and cognitive function. They even have gum now that you can chew with this, and people will chew it during like taking tests or doing things, and it does enhance cognition. Alpha lipoic acid, acetyl L-carnitine, ergothioneine enhances glutathione, which allows your electron transport chain to not decouple and you lose energy. So it will protect your mitochondria. Okay, I'm going to give you this talk real quick. You have to have your essential fatty acids. So let me show you something real quick. These are your omega-3s. This is your alpha linoleic acid into your omega-3s. This is your linoleic acid, which goes down omega-6s, okay? And omega-3s make your EPA and your DHA. These are really good ones. This is what you get from fish oil. Flaxseed also goes into the omega-3 and helps with alpha linoleic, all right? Then you got omega-6 over here. It's really good too, but it also, part of this process is arachidonic acid. Okay, so if you have a very low 3 ratio and a high 6 ratio, your arachidonic acid is going to be higher than your eicosapentaenoic acid. You'll get inflamed. Okay, this is why you need to take your fish oils to balance this out. You have to have a balanced 3 to 6 ratio, 2, 3, or 4 to 1. And you have to have a balanced EPA to AA ratio, or you're going to be inflamed and get depressed and be sad. So get yourself an essential fatty acid that has a balanced ratio of flax to borage oil and EPA and DHA. So you want to balance out the alpha linoleic and linoleic, and then you want to balance out your EPA to AA. Now, here's the thing. Everybody says seed oils are bad. If they're not cold processed, they're inflammatory. But all the seed oils, except for like flax, like the cottonseed oil and all those, they give you so many sixes that your arachidonic acid completely exceeds your eicosapentaenoic acid, and you become inflamed. Listen, your chances, if this ratios are not right, and you don't have any good omega-3s, and your all omega-6s or rancid oils or trans fatted or arachidonic, your chances for dropping dead from a heart attack go up 42%. Okay, you can do a thing, and there's a simple omega check. You can do it with a finger poke. It costs like $30. It gives you every bit of this, and a good ratio, like I said, 1, 2, 3 to 1. I've had some kids that have come in that have been homicidal. Their ratios are 70 or 80 to 1. Their brain is goners. They can't do anything. They're inflamed, no neurotransmitters, pure amygdala, no frontal lobe controlling their limbic system, nightmares. We literally get these ratios back down and they completely change, and all we're doing is controlling their essential fatty acids. So yes, you need to do these, and you need to know what you're doing when you do it, okay? Anyway, so I'm giving you all these things. Here's something really good, sulforaphane, which is basically cruciferous broccoli. If you give sulforaphane with myrosinase, it will change your brain forever. Great stuff and good for mitochondria, and really good for those of you that do hormone work. This works with, if you're using diindolylmethane or indole-3 carbinol, it helps with the detoxification of all of your estrogens, so that you don't get, bad metabolic backup of estrogen metabolism, and then all of a sudden it starts to sensitize certain estrogen receptors and you get breast cancer. Okay, this is huge. You need to be taking that. And then of course your B vitamins are really big. Okay, so look, these are things to help with mitochondrial health. I'm just giving you like a list of stuff. And then of course PQQ works with CoQ10, and then TGG works with CoQ10. NAD is a big deal right now. If you can't get it IV, you can use something called nicotinic riboside. There's a product called True Niagen. It works great, very researched. Glycine, there's D-ribose. Of course, peptides are a big deal right here. I put the peptides down. Okay, there's SS31, there's BPC157, and there's something called MOTS-C. People that have had COVID and they have long COVID and they're dying and they can't recover and their mitochondria is shot to hell, you can do organic acid tests and really see how bad somebody's mitochondria is. I will give them rapamycin. Now, rapamycin is a drug, and it is used to basically immunosuppress somebody so that they don't have organ rejection after a transplant. You can give it 1 milligram 1 time a week, and it will control inflammation and activate the TOR mechanism and promote mitophagy at a very, very, very high level. So there's a product called Benigen, or it's got an ingredient in it called oxaloacetate. I will combine oxaloacetate with something called urolithin, with rapamycin, with high doses of CoQ10, TGG, and essential fatty acids, glutathione, and you will literally pull somebody out of the depths of mitochondrial hell. And then if you fire those lasers, for people that have this and they're losing cognitive function with a lot of brain fog and they're super fatigued, like after, I'm giving COVID as an example, I'll have them use their laser 5 times a day. They will start out at 3 minutes, then progress up to 5 minutes, then go up to 7 minutes. Everybody says, oh no, lasers don't have any deleterious effect. Well, let me tell you something. Long COVID patients and people that have had a head injury, they will tell you sometimes if you laser them after 45 seconds, they start to get foggy or they don't feel right. It's not that the laser is bad, it's that their brain is that sensitive. Here's all you do: stop, do it for 45 seconds, give them nutrition, change their diet, give them graduated exercises, and then they'll be able to tolerate a minute. Then they'll be able to tolerate 2 minutes and 4 minutes and 5 minutes. And by the time you get to 7 minutes, now not only has the laser become more therapeutic, it's now an outcome assessment tool, because you're like, oh my God, they can tolerate the laser for 7 minutes. And for these people that are recovering with true mitochondrial diseases, and no, actually, I shouldn't say that, not a mitochondrial disease, like a genetic disease. Those people are really like, they're in wheelchairs and stuff. But the people that have mitochondrial damage for whatever reason, and they do not have mitohormesis, which is such a great word. Lasers help with mitohormesis. That getting rid of the infections that cause all this mitochondrial damage causes mitohormesis. The supplements I just gave you, mitohormesis. Exercising cells, mitohormesis. So this is so much fun when you start looking at this. And then here's the methylene blue that I just talked about again. I've taken it myself. It does, I will tell you, it does help with brain fog. For some people, it changes their life. And I will say this, it is very antimicrobial for Lyme disease. It is extremely effective for infectious diseases, in particular the rickettsial diseases. Okay, I got to tell you this too. Just like I gave you the essential fatty acid story, I want to give you the methylation, hydroxylation, adenosylation, and folination story. Okay, now everybody says, oh, you need methylfolate. Probably so, but not everybody. Okay, so if you have an MTHFR gene defect, you need methylation. But and listen, I would tell everybody to, one time in your life, get a methylation gene panel where you look at the COMT you look at the COMT SNP, the MTHFR, the MTRR, the MTR. Look at all of those genes. There's plenty of companies that do it. And if you end up having what's called an MTHFD1 defect, if you give too much methylcobalamin, you will make them have anxiety and make them feel horrible. You have to then shift to give hydroxycobalamin, and then you have to give them not folate, not folic acid. Don't give anybody folic acid, but you have to give them folinate, calcium folinate, okay? So most of my patients get a combination now where I give them methionine, which fires off the whole pathway, methylcobalamin, and I just give 667 micrograms. It's right around 1,000 micrograms, and I'll give it I usually give methylfolate, not cobalamin. And then I give hydroxy and adenosyl B12. Methylfolate, and then I give a separate calcium folinate. When I do that, the hydroxycobalamin supports all of their biotransformation and detoxification. The adenylcobalamin supports detoxification. Hydroxy, along with methoxy, helps you make hormones, make neurotransmitters, and then hydroxy and adenosyl helps you get the hormones that you made out. So I like balancing all of these together. I don't just load somebody up with tons of methylfolate. So what I did is I put in the notes right here a little description of that. So much better to do it that way. So and everybody that comes in, if they want to live longer, I'm like, exercise and do resistance training. Exercise your brain with cognitive stuff every day. Laser your brain, okay? Do one test that's an omega check, get your 3 to 6 balanced, get your EPA and your AA balanced, check. Look at your methylation panel, get your methylation, hydroxylation, adenosylation, and folination balanced, check, check. If you do those things right there, humongous game changers. And then look at your family history and look in your genes and find out, hey, what is going on in my family and myself that is going to kill me down the road in my genetics? And then start integrating a treatment plan that will monitor those in your lab. For instance, if you have a family history of heart disease or dementia, you can do genetic panels now that will tell you everything that can kill you in your heart and everything that can go wrong in your brain. There's actually something called an Intellex DNA and something called Boston Heart. They have hundreds of genes that will literally tell you you're going to die from this. You can run these things, and then you can develop a genetic roadmap to circumvent those things as long as possible. And if you have these things for heart, then you can measure your lipids. You can measure your advanced lipids like oxidized, your small dense lipids, your inflammatory cardiac marker. Then you can look at that stuff and say, okay, I know this is going to get me genetically. I have to watch those labs. I got to make a plan for the rest of my life. And then you do it and you stick to it. Change your diet, take your supplements, laser over your heart, and exercise, and watch the stuff. And you're going to go as long as you can. Do some people need to take medications? The answer is yes. The answer is yes. Okay. We could get into a whole different discussion on that. There's actually a gene called an SCL, it's called a SLOCO, SLCO1B1 gene. And it will literally tell you if you can take a statin and if you can transport it in your system without getting a rhabdo and it killing you. So if you don't have that gene defect and you're taking 200 to 300 milligrams of CoQ10, you're probably going to be fine, especially if you divide it into 3 small doses throughout the day. If any of you are taking a statin out there right now, divide your dosage into smaller dosages throughout the day and you will reduce the toxic burden. Please, for the love of God, take some CoQ10. You have to, okay? It depletes CoQ10 in your system. So there's all these things, but laser along with brain, hormones along with brain and laser. Methylation, hydroxylation, and adenosylation along with brain. All of these cool things. I just wanted to give you, we could break out into all these different things, but I wanted to give you a few cool nuggets, a few things to look at. And again, the common thread of what a laser does. I know I sound like a laser salesman right now, but look, guess what I'm telling you? You should get a laser so that your brain doesn't go and crap out on you. I'm just being serious. The first laser I got was pretty much for my own brain. And then I realized that, listen, in our IV suite, we have a big IV suite where people are getting treated. They pass the laser around. They just all pass it around and use it. Everybody knows their own settings. They use it. We just built the fee this is how we use it. We just built the fee into the price of our IVs, and then they rent them out. We're renting anywhere from 5 to 6 of these lasers at all time. They just know what to do and they use them at home because they would rather use the laser than take some ibuprofen or some Panadol, I think is what you guys use over there, some Tylenol. They would rather use that, and they would rather use the laser than those drugs. So a little nutrition goes a long way, but you can't out-nutrition a terrible diet, okay? A little exercise goes a long way, but you can't walk enough to make it to where it's good enough to where you don't have to do strength training, okay? You've got to use your brain, but using your brain, if you're covered with pesticides, inhaling mold all day long, and your hormones are so bad that you can't make a single synapse, you can laser all you want. All you're doing is hanging on for dear life. So I think that, man, did I make it right at 5:30?
Yes, you did.
Okay. So here's the final deal here, guys. Take your nutrients, use your laser. Yeah, you can do plunges or saunas, but if you don't do the other stuff and you're just jumping in a cold water, you're just going to experience shrinkage. And so, here's some diet stuff. You got to do some strength training. Make sure you have a healthy environment, and for goodness sake, make sure your hormones are intact. If you do that, this mitochondria right here will be happy, and your laser will be. It's an integral part of everything that you do. So there you go, guys. I threw that together for you earlier today. I hope it's something that you can grab onto. Listen, I know that was a lot of stuff real quick. So Simon, I can make sure that you get this note section so that people can kind of review it, okay?
That's great. Brandon, can't thank you enough. Does anybody have any questions?
What settings for the brain then?
Is there any specific settings you use for the brain? Brandon, I know, you all seem to have different frequencies specific to your own individual taste, but which ones would you specifically use?
Here you go. Hang on, guys. This is the stuff I didn't get to. Here's your COVID setting, and here's the places that you do it. By the way, this is straight out of a paper right here. So you can snap.
And the heart as well, Brandon, somebody's saying.
Yeah, here you go. Let me show you. So what I did is I just basically, and by the way, if anybody's suffering from COVID, Simon, I'll give you my entire long COVID lecture. This is just,
Brilliant.
it's like, here you go. Okay. Here you go. Here's some infections. I mean, look, Jerome is the frequency master. Okay. I mean, get his book, seriously, get his book. But I mean, yes, we do kind of shuffle these around a little bit. I mean, I have about 15 codes that I personally use, maybe 25 codes that I use on a day-to-day basis. But I think specificity does matter, historically speaking, and those that are really into this clinically will tell you that it does make some differences, okay? And again, I'll make this available because again, I apologize for not being able to get through all of this, but it's still, here's, my master inflammation setting. And look, 1, 10, 40, 60, you can't go wrong for a brain. Those are actually research. Those are actually frequencies like research by, places like MIT and stuff like that. 1, 10, 40, 60. And listen, I will tell you guys, the laser does have a vagal regulator on it, okay? But I will tell you, you cannot just say that violet or red has a parasympathetic or sympathetic mechanism. Some of the research that was done on that, it just wasn't done right. We know this, it does help with parasympathetic stabilization and sympathetic downregulation, but the simplistic explanation of it is just incorrect, okay? Here's some other ones for you. Bam. Here's your 1,
Right.
here's your 10, 40. Again, just kind of going through these.
Brandon, what do you do for heavy metal detox?
Okay, I'll tell you exactly what I do. For heavy metal detox,
Like with the fat treatment, there's a few people here who've got the emerald or the verjus.
oh, okay. I see what you're saying. How do I deal with it with laser? Okay, so yeah, what I'll do is I will start out with 3 minutes of master brain right over the frontal lobes. Then I will go over the neck for 3 minutes with the vagus. Okay, and then hang on a second. And then what I do is I go ahead and then I go over the liver with an immune setting. So I go over brain, go down over neck to act vagus, to get the vagus to go down to the liver to activate the P450 system. And then I activate the immune setting because the immune setting triggers something called hepcidins. It regulates the hepcidins, which allows things to flow through the liver, and you actually start to conjugate appropriately. And you go through the P450 system, and then you go through, phase 1, phase 2, phase 3 of detoxification more appropriately. That's what I do now. And I know Jerome will have like a liver detox setting, probably multiple settings in there, but that's just what we do. And look, it does really good. And a lot of times I will do this, like if I do weight stuff, if I have somebody, if I'm just blasting them with continuous violet or emerald, when I'm done, I will go back sometimes and do this detox setting. Then I'll make them, listen, if you're doing any kind of fat loss, you have to hydrate them tremendously. And if you will just give them what's called trisalt, you can just look it up, it's called trisalts, you will increase the efficacy of fat loss from laser tremendously because it changes the aldosterone and the sodium, and it increases fluid flow, and it allows the fat to wash away from the cell so you don't get reabsorption. I wish I could sit here and talk for 45 minutes just about that, because we have found that with the vibration, with hydration, has been a game changer. And by the way, the green and the violet together is really good with fat, because let me show you something. If you have fat here, okay, green and violet are really good for opening up these fat pores, but there's fibrous canals all around this stuff, right? And so what happens is sometimes you can lose the fat content, but it can't get out of its fibrous connection, so it reabsorbs. Violet helps break open the fibrous connection. So I mean, there's the whole everything on laser and fat. It's being, I mean, it's updating like tremendously. Like there's stuff that we can do that breaks through the boundaries of some of the things that we've been getting stuck with. And we could also talk about all these GLP-1 medications. We now have a way to literally measure what your immune system is doing, and it will tell you if a GLP-1 is going to be deleterious or if it's going to be beneficial.
We're doing that. I think Rob Silverman's doing a webinar, Brandon, in a few weeks. GLP-1s and non-thermal high energy laser, looking at various different aspects from how it doesn't seem to work well with the mitochondria, whereas non-thermal high energy laser does. So it's going to cover quite a bit, I think, around that sort of landscape.
Yeah, and Dr. Vajdani, who's an immunologist here in the States, he just mapped out all the immunology behind GLP-1s. Like some people will take them and all their joint pain goes away. Some people will take it and they get tremendous joint pain. But remember, fat responds to inflammation. So if you're taking a GLP-1, it may just make your muscles go down, and it may change your adipokines to drop, and you get severely inflamed, which screws up the whole mechanism. I mean, there's a lot, really, honestly, there's a tremendous amount of information that goes along with that. So I'm glad to hear that Rob is going to touch on some of that stuff.
Brilliant. Is there a genetic test to check related to methylene blue to make sure it's okay? Otherwise, it can be unsafe.
No, there's not one. So look, I'll just tell you real quick. There's 3 nitric oxide isomers. There's inducible, which causes damage. There's endothelial, which causes blood vessel dilation, which is good, right? And then there's neuronal, which is good for brain. We're concerned that methylene blue might enhance the inducible a wee bit. So I don't know. Yeah, I don't know. I mean, I'm reading some literature on it right now. I'm trying to get a little bit sturdier on it. I have a lot of understanding about methylene blue, but I'm trying to dig into it really deep. I don't want to be just biased about it because you have a bunch of biohackers saying this stuff is good. Listen, if that's the kind of person you are, change your tune a little bit and start looking at some of the literature. You're all smart people. Just because you see something on social media, and I know you know this, but just because you see something on social media doesn't mean you should believe it. And trust me, I hear some of these people say some absolutely ridiculous stuff. You're just like, oh crap, I can't believe they're saying this.
I've actually ordered some methylene blue. I haven't started taking it yet because Steve Shanks said for anybody actually using the lasers, use methylene blue as well, and they complement each other very well.
They do. That's what the literature says, man. And like I said, I take it, and I feel good on it. But I'm just doing a little bit deeper dive, and I'm probably more leaning towards it's awesome than I am, oh my God, it's scary. But I am just making sure I have all my bases covered on. Now, we'll say this, listen, don't give somebody methylene blue if they're on any psychiatric medication, including SSRIs, because it does make serotonin accumulate and can create a little bit of damage. And if somebody is pregnant, do not take it because it's a teratogen.
Cool. Heavy metal detox for brain?
Well, I will say this. So like I use chlorella, and I use citrus pectin, modified citrus pectin. I use humic and fulmic clay or diatomaceous earth, but the chlorella is about the best thing on earth. People that are doing this EDTA therapy, like IV EDTA for heavy metal chelation, all that really does is bind to the metal, bring it into your brain, make it bind to DNA, and your ANA goes up and you get neuroautoimmunity. I don't chelate anybody with intravenous EDTA. I think it's terrible. But there's a product, it's called Garden of Life. It's a liposomal toxin binder. It's not Garden of Life. I don't know. Anyway, if you look up liposomal toxin binder on a Google search, I use one of those. It's a liposomal. It's got a lot of chlorella is your best bet, okay? It is just such a good blood cleanser. But it's also got, because when you start giving these things to like pull crap out like mold and metals and stuff like that, you're gonna pull out your own minerals. So make sure that you're replacing minerals and that you're taking electrolytes and that you're staying hydrated when you do all these things that take out metals. But there's a product called HM Detox, and it's made by Pure Encapsulations, and it is a very, 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 very effective heavy metal therapeutic.
Cool.
You can just use it. You can just take one of those a day as just like almost like a multivitamin, just keep your body safe and healthy.
Cool. How much chlorella, Brandon?
As much as you can put in your mouth. No, I'm just kidding. But like you can.
That question
they have like
from Nels. I'll let you interpret what he's saying there, Nels.
if you'll just take it'll just take 2 or 3 of those HM complexes a day, you'll get plenty of chlorella. But some people just take it separately, but it's fine. I mean, it's going to be hard to overdose on it.
Brilliant. Can you just quickly repeat what you said about Tri-Salt, please?
Yeah. So Tri-Salts, we use it for hydration, and we also use it to help for people that once they like it helps with a very rapid flush and detox in your system. So for instance, like we'll have somebody take a shot, they'll put a little bit of water and we'll put a dosage of Tri-Salts in there, and they just take a shot after they get out of the Emerald or when they're doing our fat loss laser. And by doing that, we help flush any of the toxins out of the system. And I put most of my patients on a binder now.
Cool.
Like the HM Detox alone, my patient.
Alistair?
Yeah, so do we have any references for how much the mitochondria and stem cells are helped by laser?
Do we have any references how much the mitochondria and stem cells are helped by laser?
There's a lot. Well, I mean, yeah, there is some reference. If you're asking me if there is some references, the answer is yes. If you're asking me how many, I don't know exactly, but I can definitely find out. You guys, if you ever go to like PubMed, you can just go and do like a Boolean logic search where you just put in the words like low-level laser therapy, stem cells, mitochondria within the last 10 years, and it'll go plink, and it'll pop up everything in the literature. You can do these searches really quick. Actually, you can go on AI. I can go on AI right now and say how many papers are there that relate to this, and it'll give me every one of the references in 10 seconds.
Yeah, it's not how many papers, it's like what percentage the mitochondria are increased, or what percentage the stem cells are increased.
What percentage the mitochondria are increased, or what percentage the stem cells are increased? Do you have any sort of numbers?
There's no way there's no way to determine that, and I'll tell you why. Okay, so your age is you can't get a static number. The age will be a factor. How much you drink will be a factor. How many infectious diseases you have will be a factor. In other words, you could render all of it completely ineffective if you're enormously unhealthy. Like, for instance, if somebody gets stem cells from me, I will not do it until we get them to a high enough health that their crappy level of health doesn't kill everything we put in there. You know what I mean? So that varies a little bit. I don't know that I can give you really a solid answer on that. I mean, I would be completely making up a number if I did that.
Anybody else?
But I'll go look. I'll go look for you. How about that?
You can start.
Is there what, sorry?
I've got pediatric clinics.
Well, the Erchonia studies, I think the autistic children study they did was, I think, from the age of 8. But off the record, I know majority of the clinics treat sort of infants upwards. Brandon, is there a minimum age you look at? And we'll ask the same question to Jerome, who's still here at the back in clinic, because there's a lady who has a pediatric clinic.
Oh yeah, well, we treat, I treat newborns and infants all the time. I mean, it's like this, you know, not only do newborns need light, some of them need light really bad. Like when they pop, when they pop out of the oven, they have to have light so they're not jaundiced. I mean, you know, I wouldn't sit there and necessarily shine it in their eyeball. However, I have 2 kids with genetic ocular issues, and they don't have pupils, and they have all kinds of stuff. And I've literally found papers that shows that lasers at our wavelengths are appropriate for them therapeutically. And the way we're treating their eyes is we're putting it right on the side of the socket, and it will halo through, and it's not direct, but we're doing that. And they actually measured their intraocular pressures, and it has made their intraocular pressure go down. It's incredible, and it's the only thing that's worked for them. So, I mean, listen, I end up using lasers for stuff I didn't think they were going to work for, and that's the stuff that ends up working for the best half the time. It's crazy.
Cool. Is there a specific set of frequencies you use for intraocular pressure?
You know, there actually is a setting on it, and I do not have it on here. And there's so many, but you know what? I can find that out, because that is the settings were actually part of the paper, I believe. And actually, the mother brought me this literature. She's like, here, look at this. I need somebody to do this. And of course, I wouldn't have just said, hey, your kid's got a messed up eye. Let me, you know, but you know, like my wife has a retinal disease, and we laser it, but we just do it like this, just over it really quick. And we're just using red. I'm not using violet. I'm just using red. However, I do think we'll have a component to it but it's a retinal hypoxic disease. So I do think, I mean, look, with nitric oxides and vascular, you know, reperfusion, I mean, it's helped her. And then I told the ophthalmologist, her eye doctor, what I was doing, and he goes, well, one of the treatments for this is laser. I go, what do you mean? He goes, well, yeah, we just find a blood vessel back there, and we just use this like military grade laser, and it just goes in there and goes boom, and it cauterizes the laser. I go, that seems kind of dangerous. He goes, yeah, it kind of is. He goes, the laser you're using, he goes, I'm not even worried about that thing. He goes, keep using it. He goes, if it works, great.
Yeah. I know at Erchonia we're going to do some research on macular degeneration, but I don't think that's got off the ground yet.
Well, they need to, because it's really just inflammation, and you know, poor blood flow. What do lasers do? They stop inflammation, they increase blood flow. And they're not powered up enough to where the milliwattage is going to actually cause damage to very sensitive receptors in there. So, you know, you just have to make sure, like when you're doing stuff over the eyes, again, I'm very hesitant with Violet, but you have to just wisp it really quickly. You can't, I would not say hold this. I mean, again, the way we do it on the side is it's a little, it's not direct stimulation, but you guys know this stuff is going through tissue. So we've done it and it hasn't hurt the kid.
Yeah. G6PD test before methylene blue.
I do, listen, I do G6PD before I do any IVs or any psychiatric drugs. And I do, yes, I do a G6PD before I do methylene blue. Absolutely. And that's another thing. These, like a biohacker gets on the internet and says, take your methylene blue, it fixes everything. Yet the girl that's there that's like 16 years old and is pregnant and on like 20 milligrams of Lexapro starts taking it and she has major complications from it. See, I got a problem with some of this stuff.
Yeah. Anybody else? No. I mean, we can fire some questions to you. I'm conscious with everybody, it's 5:45, so our time. But Jerome, do you have anything to add to any of that? Jerome said thank you. It was great listening to you.
Jerome's a hero, you guys. Somebody, you guys could give him a big round of applause. He traveled through, you know, hell and high water to get there. That is, Jerome, that's amazing. Sir.
Brilliant. Brandon, again, thanks very much for your time. Very much appreciate it. And we'll send, we got a video recording which we can send on to people. And yeah, from both yourself and Jerome, it's just great for everybody here having this level of education because we are working tirelessly to deliver it this side of the pond. But you know, you've got some still, I don't mean to be disrespectful, but tunnel visioned practitioners that won't look outside the box, and we're very lucky. We've got a good core of clients over here now that are starting to get these light bulbs that are appearing above their heads, and whether they purchase something like this, it's immaterial to an extent. It's just having the education to know how it works and how it differs compared to other things.
Yeah, well, it's you guys, Simon, you know, I love being over there. It's great. I mean, my ancestors are from that part of the world, and it's just good. The students you guys are always great, always attentive and respectful. I really appreciate what you're doing over there, and I hope everybody, you know, realizes one thing, that your patients really, really depend on you to be your best, right? And there is a huge need because people are really, chronic illness and sickness is just getting more and more and more common. So practitioners like yourself that are spending your weekends learning stuff, you're learning about new technology, and you know, there's stuff out there that you can start giving your patients. And remember, if you increase somebody's quality of life, you change their whole family, you change the people at their job, you change them spiritually, mentally, emotionally. I would just encourage you guys, keep it up.
Definitely, thank you. We've got Dr. Brandon Brock, we've got Dr. Jerome Maruga, we've got Dr. Rob Silverman, Dr. Kurt Guest, Dr. Trevor Berry. We've got all of these guys that are probably, between all of them, they've got probably 150 years worth of experience using this. So nobody's ever on their own. We've always got these experts to try to help get our levels up to what they are over the pond. And I hate to admit that the Americans are better than us, but at the minute, I'm afraid you are.
Well, we're just near home base, man. That's all.
Brilliant. Thanks again,
I mean,
Brandon. Appreciate your time. Take care, mate.
Thanks, Tom. Thanks, everybody. Appreciate you guys. Let me know if you need me over the weekend. If you need me to jump on, I'll be more than happy. Okay.
Great. Much appreciated. Thanks, Brandon. Take care, mate. Bye-bye.
Bye-bye.